most important topics on LVAD implantation. Do not miss out on registering and attend the Fellowship Seminar, Episode 3, organized by the EACTAIC Education Committee in collaboration with the Heart and Diabetes Center NRW, University Hospital of Ruhr-University Bochum, Bad Oeynhausen, Germany, to learn more about the most important topics related to the LVAD implantation. Diabetes Center NRW, University Hospital of Ruhr-University Bochum, Bad Oeynhausen, Germany, sponsors this seminar episode. First, let us exchange our experiences and knowledge by completing this short survey and returning it to eactaic.seminar@aimgroup.eu before attending the seminar on Monday, clicking on this link. It's very simple. Type or copy the link below to your browser. Enter your full name and surname to get the certificate of attendance. Please contact eactaic.seminar@aimgroup.eu if you do not receive your link 48 hours after the registration. Please note that registrations are only possible until 17:55 on July 4, 2022. All the registrations sent after that time will not be accepted. What's in it for me? After participating in this webinar, you will better understand, acquire information on the history and updates on the practice of VAD implantation, identify the risks and develop a management strategy for right-sided heart failure after VAD implantation, understanding the coagulation management of patients with HIT who undergo VAD implantation, recognize the incidence and management options for vasoplegia after VAD implantation. Program Moderation: Vera von Dachau, Germany, Mohamed Tahan, Egypt. The first talk will be on the history of LVAD implantation and new insights, Michael Morschwus, Germany. Henning Stark, Germany, will then talk about early risk stratification and strategy for right heart failure, the Heart and Diabetes Center's approach. The third speaker is Andreas Koster, Germany, who will talk about coagulation management in LVAD patients with HIT. After that, Eric de Weil, the Netherlands, will address and answer to the question if vasoplegia is still a problem. Finally, the faculty will address the audience's questions during the open discussion session. Meet the speakers. Professor Vera von Dachau will moderate this seminar episode. She is the director of the Institute of Anesthesiology and Pain Therapy at the Heart and Diabetes Center Bad Oeynhausen, Ruhr-University Bochum, Germany. Professor Mohamed Tahan will moderate the seminar episode with Professor von Dachau. He stands as a professor of cardiothoracic anesthesia and surgical intensive care, Mansour University, Mansoura, Egypt, and associate professor of cardiothoracic anesthesia, Imam Abdul Rahman bin Faisal University, Dammam, Saudi Arabia. He is the EACTAIC Education Chair and EACTAIC Board of Directors member. Bochum. His clinical and research interests are heart insufficiency, short-term and long-term mechanical assist devices, and heart transplantation. Dr. Henning Stark. He worked previously at the University Hospital Leipzig and Hanover Medical School. In 2020, he joined the Heart and Diabetes Center team, NRW, in Bad Oeynhausen. His scientific interests lie on the one hand in thoracic anesthesia and here, especially in the field of non-intubated VATs. On the other hand, he also deals with risk-adjusted therapy strategies in the LVAD field. Dr. Andreas Koster. He worked at the German Heart Institute, Berlin. In 2010, he joined the team of the Heart and Diabetes Center NRW in Bad Oeynhausen. His scientific interest is anticoagulation strategies and coagulation management during cardiac surgery. The special focus of his scientific work is the management of patients with HEPARIN-induced thrombocytopenia (HIT) during cardiac surgery. Dr. Eric de Weil. He started post-residency career at the University Medical Center in Utrecht in Holland, focused on cardiac anesthesiology, and obtained his PhD on advanced cardiovascular monitoring. He worked as a cardiac anesthesiologist at Harefield Hospital, RBHT London, UK, for 3 months in 2018. He has been the chair of the EACTAIC Subcommittee on Transplantation and Ventricular Assist Devices since 2017. His areas of interest are heart and lung transplantation, ventricular assist devices and severe early postoperative complications, such as vasoplegia, right ventricular failure and kidney failure, and their relation to inflammatory biomarkers. We are excited to welcome you during the EACTAIC Fellowship Seminars, Series 1, Episode 3, next Monday, July 4, 2022, at 18:00 to 19:40 Rome time. Do not miss it out, and stay tuned.